Девочка. Good afternoon, guys. Today we have lecture mammary gland disease. In classification, we divide malformation, abnormalities, mammary glands, disturbance of growth of mammary glands, trauma of mammary glands, inflammatory diseases, dysharmonic hyperplasia, mastopathy, and gynecomastia. Lactocele is cyst of mammary gland, mammary tumor, and rare disease of mammary gland. Abnormalities. We divided amastia, absence of both mammary glands, monomastia, absence of one, anisomastia, aplastia of the one mammary gland, enlargement of another, atelia, absence of nipples, polytelia, increasing in number of nipples, additional mammary glands. It's mostly in axillary space, inclined to malignization. On this picture you can see polytelia. Polytelia, the nipples are located on embryonal mammary lines from axillary space to genital organs. On this picture you can see hypomastia over the right mammary gland. Female patient, 14 years. On this picture, additional mammary glands. Female patient, 21 years. And this picture, additional mammary glands too. Female patient, 39 years. Growth disorder. True hypertrophy of mammary glands to 600-800 gram. Normal is 150 to 400 grams. Sexual maturation, pregnancy. False hypertrophy. It's macromastia, in result of growing fat tissue. Hypertrophy, less than 150 grams. And mastoptosis. On this picture you can see hypertrophy of the left mammary gland. Female patient, 14 years. Trauma of mammary gland. We divided hematoma, oleogranuloma or lipogranuloma, and pseudocyst. Noticeable skin retraction. On this picture you can see noticeable skin retraction. In anamnesis have been trauma by histological investigation pseudocyst. On this picture you can see induration and retraction of the skin above tumor by histology oleogranuloma. Next disease, mastitis. We divide acute and chronic, specific, tuberculosis, syphilitic, actinomycotic, and non-specific, lactational and non-lactational mastitis. Galactophoritis, it's inflammation of milk ducts. Areolitis, it's inflammation of areola glands. Lactation mastitis, in 80–85% of cases, mostly occur in primipara. Non-lactational mastitis in 10–15% of cases. And mastitis of pregnant, 0.5 to 1%. Causative agent mostly is Staphylococcus. Opening gates often are fissure of nipples. On this picture you can see fissure of nipples. On this picture you can see localization of abscess at mastitis, subareolar, intramammar, and retromammar. By inflammatory process, we divided serous mastitis, it's edema of mammary gland, increasing of temperature to 39 degrees. Infiltrative mastitis, if finishing feeding or expression of breast milk arise infiltrations. Intramammary abscess, redness, fluctuation, focus. Phlegmonose mastitis. Almost whole gland is involved to inflammatory process, may be septic course. Gangrenous mastitis may be development of vascular thrombosis. The skin have pale green or dark blue purple with bubble, necrotic areas. On this picture you can see redness at postnatal mastitis. On this picture, periareolar abscess. Chronic mastitis. Infiltrative. After prolonged topical antibiotic therapy, there is infiltration, lack of cartilages, density grow up in the mammary gland. Pain is at feeding and milk feeding. Plasmacellular hyperemia, edema of areolar skin and adjoint areas. Then hyperemia pass off, retains solid painless infiltration. Prevention of mastitis. Sanitation of endogenous infectious focus. Prevention of hospital infections. Select and change of the underbodies. At inverted and retracted nipples. Traction and forming of nipples by clean hands. To prevent tissue formation of mammary gland, it is necessary to wash it by water with child's soap and dry by hand tool. At feeding need, an infant need to grasp not only whole nipple, but a part of areola. Hygiene of underwear and hands. Treatment of mastitis. We used elevate position of gland, immovable bandage or antibodies, breast pump or expression of breast milk. Sometimes we used drugs for stop lactation. It's Dostinex, Parladel, Alactin. Antibiotics parenterally or in retromammary space with Novocaine. Physiotherapy, ultra-high frequency treatment, electrophoresis, and ultrasound. On this picture you can see type of incisions at mastitis. Radial incision with contour opening in case of intramammary abscess, and all incision under gland in case of retromammary abscess. On this picture you can see ultrasound-guided drainage. Mastopathy, fibrocystic breast disease. It's hormonal-dependent adaptive reaction of female mammary gland that declares itself by cyst development, ducts enlargement, glandular and interductal epithelium proliferation, and fibrosis. On this picture you can see normal breast tissue and fibrocystic breast disease, cyst in the mammary gland. Synonyms: cystic mastopathy, chronic cystic diseases, mesoplasia, Cooper's disease, fibroadenomatosis, recluse disease, and Schimmelbusch disease. What is fibroadenosis? Age group 30–50 years. Aberration in normal cyclical hormonal effects. Cyclical mastalgia with nodularity. Large cysts often contain brown fluid, which gives a blue color to the intact cyst. The blue domed cyst of blood good. Pathomorphology. Fibrosis, cyst formation, adenosis, epitheliosis, papillomatosis, and apocrine metaplasia. Occur for 20% female under 30 years and in 60% older 40 years. 50% are diffuse mastopathy, 20% nodal mastopathy, and 18% fibroadenoma. As a rule, new cysts and nodules are not occur at menopause. It can be combined with mastodynia, painfulness and feeling of the gland edema before menses, premenstrual tension, pre-malignant changes, and cancer develop in 5% patients. Next, at 60, excuse me, at 60, 92% female that have hyperplastic process of genital organs reveal of diffuse benign mammary gland disease. At safe menstrual cycle, hyperestrogenous conditions result to hyperprolactinemia that promote development of proliferative process in mammary gland. Disorders, gonadotropic function of hypophysis, could be appear adiposis, hyperlipidemia, changing of prolactin and insulin secretion, and other. Forms of the mastopathy. We divided ovarian form, hypothalamo-hypophyseal form, thyroid form, its decreased level of thyroid stimulation hormone, and luteinizing hormone. Hepatic form, it's hyperestrogenemia that is caused by disturbance in inactivation estrogens as a result of hepatic disease. And epinephroseal form. Clinical classification of the mastopathy. We divided diffuse mastopathy and nodal mastopathy. Nodal mastopathy, simple form and proliferative form, precancer. Clinical picture. Painfulness of mammary gland, often combines with feeling stomach overcrowded, aerophalia, and constipation. Headache, nervousness, and depression, if all phenomena disappear after start of menses, premenstrual tension. In palpation, areas of induration, mostly in upper external quadrants. Clinical course. Secreting mammary gland and pressing to nipples may be discharge of the colostrum, clear or green secret blood. Nodal form best determined in standing position, supine position by pressing of palm to breathe they disappear. Negative symptom by killing. Clinically microcystic, and non-productive form. Cytological classification of the mastopathy. First group, it's fibrocystic mastopathy without epithelium proliferation. It's 70%. Risk of development cancer is absent. Second group, fibrocystic mastopathy with epithelium proliferation but without sign of atypia, include adenosis. It's 25-30%. And third group with epithelium proliferation and atypia. It's precancer, cancer in situ, in 5%. All causes. Mastalgia. Etiology: relative hyperestrogenism, hyperprolactinemia, psychological, caffeine, and abnormal lipid metabolism. Clinical mastalgia: menstruating age group, hormone-related, pain in a period of ovulation, dull diffuse bilateral, upper outer quadrant. Clinical features: lump, cyclical mastalgia, and nipple discharge. Non-cyclical mastalgia causes musculoskeletal pain and Tate's syndrome. Malignancy. Features: unilateral, chronic, burning or dredging, pre- and post-menopausal. On this mammogram, you can see breast cyst. On this picture, you can see subcutaneous cyst at mastopathy, female, 63 year. Breast cyst. Definition on integrated involution of breast tissue. Age group 30, 40 years, 50 years. Confirmed by ultrasound and aspiration. On this picture you can see breast cyst with ultrasound examination. On this picture you can see mammography, cyst of mammary gland. Clear, aspirate, discarded, blood-stained cytological analysis, pneumocystogram in complex cyst, inject air into the cyst and then mammogram. On this mammogram, cyst of breast. Diagnostic: complaints, anamnesis, and gynecological. Palpation of mammary gland in standing position and supine position. Ultrasound investigation with elastography of breast, thyroid, adrenal glands, genital organs. Hormonal investigation: tyrotropin, luteinizing hormone, progesterone, estradiol, prolactin. Puncture aspiration biopsy and cytology investigation of the biopsy material. Cystic contents, discharge from nipples. At suspicion to cancer is necessary determination of estrogenic and proestrogenic receptors. For histological examination, we used for biopsy, we used fine needle aspiration, cytology, core needle biopsy, incision biopsy, and excision biopsy. On this picture, you can see fine needle aspiration cytology. We used 21 gauge needles and 10 milliliter syringe. Multiple passes through lump without releasing negative pressure. Aspirate is smeared onto slide and fix it. Differentiate solid and cystic lesions. On this picture you can see core needle biopsy under ultrasound guidance. This picture mammotomy, used for taking stereotactic biopsy from mammographically detected breast lesions that are not clinically palpable. Diagnostics. Oncomarkers. We use oncomarkers CA15 to 3, breast ductography, pneumocystography, thermography, mammography on 3-10 days menstrual cycle, have local structure deformation, focuses, numerous small point, uh, microcalcinosis is pathognomic for cancer, sectoral resection with urgent biopsy, magnetic resonance imaging of breast for young patient, and liver brain at suspicion of metastatic cancer. Radionuclide bone scintigraphy, MTS to bones, uh, MRI at CT scan of skull at discharge from nipple and hyperprolactinemia, its need excluding of tumor or a hypophysis hyperplasia. Excuse me. On this mammogram, you can see numerous small point microcalcinosis is pathognomic for cancer. Breast imaging future use of polyposition emission tomography, breast stim excuse me, breast scintigraphy mammography, nuclear medicine breast imaging, Mireluma technetium 99, sestamib compound, computerized thermal imaging, CTI, computerized tomographic laser mammography, digital tomosynthesis or three-dimensional mammography, elastography, digital subtraction mammography. On this picture you can see ultrasound and elastogram, lymph node, red and yellow color. On this picture fibrous lymph node, blue and violet color. Here cancer of breast, blue and violet color. This picture postoperative cicatrix, red and yellow color. Ultrasound and mammography categories. We divided. 0 category. Incomplete needs additional imaging. 1 category, normal. 2, benign finding. 3, probably benign. Next investigation after 6 months. 4, suspicious abnormality. Biopsy shall be considered. 5, highly suggestive of malignancy. And 6, non-biopsy, prone malignancy. Treatment. Most women with fibrocystic changes and no symptoms do not need treatment, but closer follow-up. Excuse me. Rule out malignancy, manage as cyclical mastalgia. Next treatment, premenstrual tension, restriction of salt at 7-10 days before menses. Diuretics, cowberry leaves, birch buds, strawberries, furosemide 10 mg plus aspartame. Vitaminotherapy, vitamin E 400 mg from 12 day to menses, 2 cycle. Magnesium B6 by 1 tablet twice a day for 1 month. Polyvitamins, Unicap. Solution of potassium iodine. 0.25% by 1-2 teaspoon for 1 year at ovarian cyst, anovulation, and insufficiency of lutein function of ovary. It is contraindicative at hyperthyroidism, liver disease, and hypoestrogenemia. Next treatment. At hyperprolactinemia, we used next drugs, mastodinone in severe degree, Dostinex, 0.25 milligram twice a week. At young female with adenosis and fibrous form of the mastopathy, we used mastodinone. At small cystic forms, more effective, phytotherapy plus beta-carotene. Oral contraceptive for 28-48 years female with hormonal imbalance. At climacterium and climacteric, give anti-estrogen, tamoxifen 10 mg or Fareston 20 mg for 1-3 months. Next treatment, cyclic hormonotherapy, combination of estrogens and progestin. At combination proliferative dysplasia of mammary glands with genital pathology and disturbed endocrine regulation. Sinestrol from 6-7 days to 10-12 days, 0.5 or 1 milligram. Pregnyl, progesterone, from 14-20 days, have to abolish to 2-3 days before menses. Androgenic drug at endometriosis, hyperestrogenemia, sedative, antidepressants, hypnotic, psychotherapy, and dietotherapy. Bleeding mammary gland, Means disease, was described by Means at 1912 year. Causes are extra and intramammary. Intramammary causes are intraductal papilloma, intracanalicular fibroadenoma, mastopathy, at epithelium proliferation or forming granulative tissue, malignant tumors. At breast cancer, it may be only appearance of non-palpated tumor. On this picture you can see discharge from nipple as a drop of blood at intraductal papilloma, female, 58 years. On this picture you can see blood discharge from numerous pores at intraductal papillomatosis, female, 42 years. This picture you can see breast ductography. Ductography. A ductogram is a mammographic procedure that is performed to help identify the breast duct that may be the source of nipple discharge. In this picture you can see ductogram, breast ductogram, contrast surround oval mass with irregular outline. On this picture you can see ductal ectasia. Craniocaudal ductogram shows a dilated ductal system. On this picture you can see carcinoma. Craniocaudal ductogram shows an outlined intraductal abnormality and know the pleomorphic calcifications. Ductoscopy, a fiber optic scope less than a millimeter thick is inserted into the milk duct at the nipple and threaded deep into the breast through the duct. An imaging system displays the output of the scope and a computer monitor. Samples of epithelial cell can be collected onto microscope slides for further analysis. Indications for ductoscopy. Patients with pathologic nipple discharge. Patients who are at high risk for developing cancer but have normal breast on examination and imaging studies. On this picture you can see ductoscopy. Upper picture is normal, low picture is papilloma and cancer. Mondor's disease, thrombo and periphlebitis of sternoepigastrical veins, was described by Mondor in 1929 year. Band-like painfulness, phlebitis about 10–40 centimeters, clearly visible at lift up of the mammary gland. Sometimes it determined in axillary space. In case of intermammary or submammary location, may retract skin and simulate umbilication symptom or retraction skin symptom. On this picture you can see Mondor syndrome, band-like superficial phlebitis of the right sternoepigastrial vein. Female, patient 37 years. On this picture you can see Mondor's disease 2, thrombo and periphlebitis of sternoepigastrical vein, bending the right mammary gland that pass to cranial direction. Female patient 21 years. Benign tumors, fibroadenoma in 25% of mammary gland tumors, numerous in 10–15%, bilateral in 10% causes, prevalence fibrous tissue, adenofibroma, prevalence epithelium tissue. Excuse me. Adenoma purum, mainly appear at pregnancy, quickly grow up, occur rarely. They grow up slowly, pregnancy stimulate growth and assist to malignancy. On this picture mammogram, you can see fibroadenoma. Fibroadenoma is benign solid tumor composed of stromal and epithelial elements. Represent a hyperplastic or a proliferative process in a single lobule. Etiology is unknown. Thought to be due to hormonal influence. Risk of malignant transformation is rare. Types of fibroadenoma. Simple, solitary or small, less 1 centimeter. Multiple, more 5. Juvenile, in young women between the age of 10–18 years. Large fibroadenoma, from 1–3 centimeters. Giant, more 5 centimeters, rapidly growing. And complex, contain other histological changes, such as sclerosis adenosis, duct epithelial hyperplasia, epithelial calcification, associated with slightly increased risk of cancer. Clinical features: between the age of 15–25 years, painless lump breast mass confused with phylloides, microscopic picture, intracanalicular, its stromal proliferation predominance, compress the duct, and pericanalicular, its fibrous stroma proliferates around the ductal space. Now in this picture you can see phylloids tumor. Its morphological picture, phylloids tumor, fibrosis. Rare mammary tumors. We divided lipoma, angioma, lymphangioma, adenopapilloma, leiomyoma, androma, and dermoid cyst. On this picture you can see atheroma of pectoral gland. Male patient, 46 years. Rare mammary gland disease, tuberculosis. Separate hard tuberous nodules in gland mass. May merge with case-type destruction, fistulas and ulcers. Syphilis, inflammation. Hard chancre, painless gumatose nodes. In case of destruction, produce ulcers. Actinomycosis, dense nodes, tuberose infiltration, fistulas with liquor pus and grain. Echinococosis, spontaneous necrosis, and filariasis with elephantiasis. On this picture you can see tuberculosis of the left mammary gland with forming cicatrix and fistula. Female patient, 32 years. The gland was amputated. On this picture, tuberculosis of the right mammary gland with small tuberosis and enlargement of nipple. Female patient, 26 years. On this picture, acute spontaneous total necrosis of the mammary gland. Histology, white spirit thrombosis with bacterial embols. Symptoms of the breast cancer: flattened skin, skin retraction at lifting arms by patients, symptom of umbilication, nipple retraction, pair sign, irregular fold forming, taking of the skin by thumb and index fingers, symptom of Krause, thickening of the areolar skin, positive symptom of Kenny, symptom of lemon crust, and palpation of supraclavicular axillary lymph nodes. On this picture you can see the symptom of lemon crust at non-operable breast cancer. On this mammogram you can see cancer of breast. This mammogram 2, cancer of breast. On this picture you can see a type of excision of mammary gland. First picture, excision in the upper square. Second picture, excision in the twice medial square. Third picture, excision in the twice lower square. And fourth picture, excision in the twice external square. On this picture you can see parallel incision on a border areola. And on this picture, excision of removed part of mammary gland. On this picture, uninterrupted subcuticular single closure layer suture. And this picture finish exact adaptation of wound border. Thank you for attention.